I am extraordinarily excited to announce the fact that Exeter Health Resources has entered into a letter of intent that reflects a proposed affiliation with the health system known as Beth Israel Lahey Health. It is a proposed integration into Beth Israel Lahey Health that represents perhaps one of the most significant new pathways of evolution for our health system in Exeter. This decision to enter into the letter of intent with Beth Israel Lahey Health came as a result of an in-depth analysis and evaluation by the executive management of Exeter Health Resources, as well as the Board of Trustees and medical leadership of Exeter Health Resources. And the decision to enter into this letter of intent really reflects the challenges that we are facing as a health system, not only today, but as we think about the future, and the future of our healthcare delivery system, and most importantly, the future healthcare needs of our community. This evaluation process, stretching out for more than a year, considered a variety of different options for affiliation for our health system. Those options included health systems within the state of New Hampshire, outside of the state of New Hampshire, throughout the broader New England region, and beyond. But the fundamental aspect of this evaluation really reflected who we are as a health system, what we aspire to be as a health system, and how do we match and sustain our mission of providing the very best health care to those future challenges that we expect to face in the future. Exeter Health Resource is one of the few remaining standalone health systems in the state of New Hampshire, and that's unique. But equally as importantly, as a standalone health system, the future challenges represent significant hurdles for us to continue to pursue and sustain our mission, to sustain our aspirations as a healthcare delivery system. Beth Israel Lahey Health is the perfect match for our health system, not only in terms of its scope, in terms of its competencies, but in terms of its alignment of its mission, its value, and its commitment to community healthcare. In fact, Beth Israel Lahey Health is one of the few academically based medical care delivery systems in New England where the vast majority of its health care is actually provided in the community. There is no better match for Exeter than a health system that has the vast majority of its health care provided into the community. Beth Israel Lahey Health is comprised of 13 health systems and a broad network of ambulatory care facilities, all of which are substantially grounded in the communities that they serve. The essence of their mission, the essence of their values, the essence of who they are as a healthcare delivery system is grounded in not only the needs of the community, but also grounded in the ongoing needs of the larger New England region. It is an academically based medical center. As a result of that, has a broad base of research and extraordinary resources that enable it to deploy into the local community advanced care so that those communities have access to the very best care without necessarily having to make trips down to Boston. Beth Israel Lahey Health understands our mission as a healthcare delivery system. And as a healthcare delivery system, we have been known for our innovation, our commitment to excellence across all the systems of care that we provide to the community, and Beth Israel Lahey Health is deeply aligned with that commitment. As I said earlier, there could be no better partner for this healthcare organization, and I believe that there could be no better partner for this community as it seeks to achieve the best health status that it can in the future. Exeter Health Resources, Exeter Hospital, has existed in this community for 125 years. Over those 125 years, our identity has grown, it's become more solidified in the community. Equally as importantly, generations of citizens have come to rely on this hospital and its health system for the delivery of care. Beth Israel Lahey Health will enable the continuation of that mission that Exeter Health Resources has developed over 125 years of sustaining healthcare in the community, to improving the health of the community. As a relatively small healthcare system, we have been uniquely privileged to be able to provide those services over these past 125 years. When we think about the partnership with Beth Israel Lahey Health, we think about the next 125 years and how Beth Israel Lahey Health can enable us to continue to grow that mission, sustain that mission, and improve the lives of every community member, again, for the next 125 years. By choosing to join the Beth Israel Lahey Health System, Not only have we made the right choice to sustain our mission into the future, but it's right for our staff, our medical staff, our clinical staff, our support staff. It's right for our community. It's right for the state of New Hampshire.